plague doctor in your head is wearing the wrong costume. You see the black coat, the round glass eyes, the wide hat, the giant bird beak stuffed with herbs. But for the Black Death, that image is a lie. In this plague, you do not have the bird mask. You have a wool gown, tired hands, a bag of tools, and a city begging you to explain why families are dying before sunset. Today, you are the ordinary physician called into the house everyone else is trying to escape. By the end, you will understand why the most terrifying part of the job was not touching the sick. It was being expected to save them while knowing you barely understood what was killing them. This is worked to death. We do not read history from a safe distance. We step inside it without armor. And today, your job is to walk toward the door everyone else is backing away from. Your morning begins before sunrise. Somewhere nearby, a cart will scrapes over stone. Bodies are being collected before the streets fill again. Through the wall, you hear coughing. Not one cough, many. A whole row of houses breathing badly. You dress like a respected man. A wool gown, a cap, maybe gloves if you have them. No terrifying bird face. You look less like death and more like a tired professor who made a very poor career choice. Then the first knock comes. A boy stands at your door, trying not to cry. There is swelling under his mother's arm. She was speaking in the night, but now she is burning hot, confused, and the dark marks have started. You know what house this is now. You also know you should not go, because every physician in the city knows the same rule. The first house is never the last. So you follow the boy. Outside, doors are half closed. Windows are watched from behind cloth. A woman sees you pass and pulls her child behind her. Not from the patient, from you. Rosemary burns in a pot. Vinegar stains a doorway. Nobody agrees on what works. Everyone agrees on being terrified. Before you enter the house, you smell it. Closed rooms, sweat, old straw, smoke from herbs. The family has tried everything except understanding the disease, because understanding is not available. Inside, the family crowds the bed. A husband watches your face before you even speak. So you arrange your face before you arrange your tools. He is not listening for knowledge yet. He is looking for confidence. On the bed is the patient. Her skin is hot. Her eyes drift. Under her arm is the swelling the boy described. It is not just a lump. It is a purple-black knot of heat and pressure, swollen so violently that the warmth seems to reach your fingers before you touch it. This is a bubo, though naming it does not make you powerful. It only makes you sound like you have a plan. And a plan is what they are starving for. You examine the swelling. You examine the urine they have saved for you in a cloudy glass. You ask questions that sound medical but are really just prayers in different words. The husband answers too quickly. The boy says nothing. This is medicine before certainty. Then someone mentions a treatment from another town. A chicken, not cooked, not eaten, alive, held against the swelling to draw the poison out. The room becomes completely silent, because even in the middle of a plague, there are moments where everyone can hear how insane hope sounds. And here is the worst part. You do not laugh. You cannot laugh. A neighbor brings the bird, kicks. The patient groans. The husband looks at you as if you are about to perform a miracle. You know this might do nothing. You know it might make the room dirtier. You also know that if you refuse, they may decide you are giving up on her. That is the trap. Doing nothing also looks like failure. So you do something. Maybe you press herbs near the swelling. Maybe you wash the skin with vinegar. Maybe you lance the bubo and the patient screams so sharply that the boy finally starts crying. Maybe the chicken scratches your sleeve. And for one terrible moment, you understand what medicine has become. A frightened animal, a frightened family, and a frightened doctor pretending fear has a method. Not exactly the kind of job you brag about at dinner if anyone still invites you. You give instructions. Keep the room cleaner. Burn herbs. Change the bedding. Avoid foul air. Send for you if she worsens. They cling to the last part. If she worsens. As if there is a road leading away from this bed. Outside, the boy follows you with his eyes. He wants to ask if his mother will live, but he is old enough to know the answer might destroy him. You do not promise. Promises are dangerous in a city where morning predictions become evening lies. The next house is worse, not because the patient is sicker, but because the family is angry. Their father died yesterday. Now their daughter is feverish. They paid. They followed the instructions. Now they want to know why death came anyway. You are also a target. The husband steps closer. Not enough to threaten you, just enough to remind you that grief has hands. In a plague city, people search for blame the way starving people search for bread. They blame air, strangers, sin. And because you are standing in the room, you are available. Then you hear the cough that changes the room. There is another patient in the corner. A servant, maybe. He is breathing fast with a cough that sounds wet and wrong. When he coughs into the cloth, there is blood. The room changes. This could be the kind that moves through breath. Suddenly the danger is not only on the bed. It is in the air between his mouth and yours. You step back. Not enough for anyone to notice. Just enough for you to hate yourself. Because now the truth is naked. You want to help, but you also want to live. Every house asks you to choose both. Be honest. If that cough happened 2 steps from your face, would you stay? Or would you leave before anyone could stop you? Tell me honestly. No hero answers. By noon, you have visited 4 houses and given 3 families instructions you do not trust. Then you feel something under your own jaw. A tiny ache. Maybe nothing. Maybe a muscle. Maybe panic pretending to be a symptom. You touch your neck once. The skin is warm. Warmer than it should be. You cannot tell anymore. You touch it again. The husband is watching your hand. You drop it. A calm physician does not check his own body in front of patients. A calm physician does not search for the same swelling he just lanced on someone else. Maybe it is nothing. Maybe panic. Maybe this is how every doomed man begins negotiating with his own body. The bird mask myth is tempting because it makes the past look prepared. It gives fear a costume. But you have no costume. Just skin, breath, and a door you keep choosing to enter. By evening, your hands smell of vinegar, smoke, sweat, and the things you could not wash away. You avoid touching your own face. Then you realize you have already touched it many times today. Very professional. Very doomed. You are not afraid of entering another house. You are afraid of entering your own. Through the window, you see your wife setting the table. She has not seen you yet. You consider sleeping outside. Not because you are sick. Because you might be. Because the distance between maybe and infected is only 1 breath. You do not enter. Not yet. Then a messenger finds you. Another house. Important family. Good payment. Urgent. You want to say no. Instead, you ask where. This is how jobs like this destroy people. Not always with one dramatic moment, but with repetition. One more door. One more bed. One more family staring at you as if you are the border between life and death. One more chance to be useful. One more chance to be infected. At the last house, the patient is already beyond your skill. The breathing is too shallow. The fever has burned too long. You can offer comfort. You can give a mixture. You can say words that sound like treatment and feel like mercy. Then you hear a small voice behind you. You said if she worsens. It is the boy from the morning. Not inside the room. Outside the doorway. He does not need to say anything else. You said if she worsens. And now she has worsened. And he has come to collect the promise you never actually made. For a moment, all the houses become one house. All the patients become one patient. All the families become one family. You were never moving from problem to problem. You were walking in circles inside the same disaster. The family beside the bed asks the question at last. Will he survive the night? You could lie and become kind. You could tell the truth and become cruel. You choose something in between. You say the night will be difficult. They understand. The patient dies before morning. Only near the end of the day do you understand what the job has really been. Not treatment. Not courage. Not even survival. Certainty. They needed you to stand in the room and pretend the world still had rules. That is why the real Black Death physician is more frightening than the bird mask version. The mask is a symbol. The real man had a face. A tired face. A sweating face. A face close enough to count the breaths of a dying stranger, knowing that every breath could be the one that kills him, and still choosing to stay, not because he was fearless, because leaving was another kind of failure. If this episode made you see history differently, help fund the next investigation without spending anything. Subscribe, like the video, and leave a single heart in the comments. Costs you nothing, but it helps bring the next worst job back from the dead.